Psychology, the scientific study of behavior and mental processes, plays a major role within the occupational field of psychiatric nursing. Psychiatry is defined as the treatment of mental illness and abnormal behavior, and a nurse is defined as a person trained to care for the ill or infirm. Psychiatric nursing, also known as mental health nursing, specializes in treating patients of all ages that suffer from psychological illnesses. Some of these illnesses include schizophrenia, bipolar disorder, psychosis, depression, and dementia. Psychiatric nursing developed near the end of the 19th century, when it was decided that patients in mental hospitals were as much in need of nursing care as patients in other hospitals. Since this breakthrough, mental health nursing has grown to be a part of all diploma and baccalaureate nursing programs. One very common mental illness psychiatric nurses treat is post-traumatic stress disorder, also known as PTSD. Symptoms of PTSD may arise after a traumatic event, causing an overreactive adrenaline response. This response creates deep neurological patterns within the brain that persist long after the event has occurred, triggering the same fear felt at the time of the traumatic event. Researchers have also found biochemical changes within the brain and body caused by PTSD. For example, combat veterans of the Vietnam War with PTSD showed a smaller hippocampus compared to veterans having suffered no such symptoms. Researchers theorize that the high levels of stress hormones secreted during trauma suppress hypothalamic activity. While PTSD is most often associated with war, there are actually several forms of trauma that can trigger the disorder. Some of these include sexual abuse, terrorism, and disaster. For example, a person who survives a severe car accident may develop symptoms of the disorder, such as anxiety and depression, and may also begin to experience flashbacks and nightmares about the event.
There are many factors that increase one's chances of developing PTSD. For example, being deployed overseas for a long period of time or receiving an injury to the brain can dramatically increase one's chances of developing symptoms. Also, individuals who are single, have family issues, or are female are also more likely to develop PTSD symptoms. CBT is a type of counseling used to treat PTSD. In the first phase, patients are educated about PTSD symptoms in CBT, and then they focus on helping a patient become aware of traumatic thoughts and feelings, which are then challenged by the patient to help deal with problems in the day-to-day. Finally, patients address how beliefs like trust and relationships can change as a result of trauma. Similar to CBT, prolonged exposure therapy, also used to address PTSD symptoms, begins with education about symptoms of the therapy. The patient begins by controlling his breathing to calm himself down. The patient is then presented with real-life experiences associated with their trauma to lessen the stress over time. The patient proceeds by verbally explaining their trauma to lessen the seriousness. Francine Shapiro is the originator and developer of EMDR, used to treat PTSD symptoms. She is a senior research fellow emeritus at the Mental Research Institute and is executive director of the EMDR Institute. She founded and presides over the EMDR Humanitarian Assistant Program, a nonprofit organization that delivers EMDR treatments worldwide. EMDR stands for Eye Movement Desensitization and Reprocessing. The first step of EMDR is an assessment of client readiness. Phase 2, preparation, involves establishing a relationship between the patient and the therapist. In Phase 3, the team identifies the traumatic experience to be addressed in that session, and in Phase 4, the patient's trauma is measured in subjective units of disturbance. Phase 5 focuses on replacing original self-beliefs with positive new ones. In the body scan phase, Phase 6, the client assesses his or her current level of physiological disturbance in response to positive new cognition. The closure phase and reevaluation phase addresses the patient's handle on their cognition. In several studies of 100 plus patients, 80 to 100% exhibited drastic improvements.
Substance abuse. Noun. The overindulgence in or dependence on an addictive substance, especially alcohol or drug. It is characterized by poor impulse control, inability to cope with current pressures or stressors, a pleasure-seeking tendency, and a desire to escape from reality. Inside the brain, there are dozens of tiny chemical messengers called neurotransmitters. These transmitters are responsible for triggering certain sensations like dopamine, increasing feelings of pleasure, and endorphins, relieving pain. Certain substances can manipulate the transmitter receptor process and allow the user access to whatever feelings the transmitters would have provided if they were active. Over time, the brain attempts to adjust to the higher levels of neurotransmitters and will adapt to not respond to the much lower, more natural levels. This graphic displays how the brain of a drug abuser is not as responsive to normal levels of dopamine as the brain of a healthy human. This adaptation results in the physical and psychological dependence characteristic of drug abuse. Now this is where psychiatric nurses come in. Substance abuse nurses, specialized in psychiatric nurses, are trained in pain management and help to regulate treatment for substance abuse patients. By educating them on the risks of continued usage and providing emotional support, nurses tend to physical as well as mental health. Building a patient's mental health is important in preventing relapses. This is Louisa Degenhardt, a researcher at the National Drug and Alcohol Research Center Faculty of Medicine. She completed her PhD in 2001 at the University of New South Wales in Australia, studying the comorbidity of drug use and mental health problems. She's established several projects such as the National Illicit Drug Indicators Project and the Illicit Drug Reporting System. One of Degenhardt's more recent projects is the Poppy Project. In the last 30 years, there has been a large increase in prescribed opioid usage. Australia has seen a 300% increase in opiate dispensing, while Europe and the US have seen even greater increases. Knowing these statistics, Degenhardt focused the project on examining the personal level behaviors of people on opiates. The study looks at patterns of written prescriptions, patterns of use, and the outcomes or costs due to usage. In order to do this, the annual cost of prescribed opiates is estimated, the clinical usage of opiates is examined, including use in therapy, and the patterns of opiate use outside of clinical operations is examined as well. The study aims to identify any trends in opiate use.
The study of psychology is a vital component within the field of psychiatric nursing. Without the solid understanding of how the mind functions and operates on a daily basis, a psychiatric nurse cannot begin to assess, diagnose, treat, and in some cases, prescribe medication for the many patients who suffer from psychiatric disorders. Thank you for watching.